basics. I'll say that again because we just started recording. Welcome to our training in essential crisis care basics. Today, we're going to cover some very foundational topics in crisis care, especially for those who are responding to Hurricane Helene. But keep in mind that what you learn here can be applied not only in disaster, but also in other contexts of individual, family, community crisis situations. And these are what we consider the essential basics. It's a combination of psychological first aid and trauma-sensitive care principles and practices. And by the end of this training, Phil and I want you to go away with a strong knowledge base and some effective skills for helping people who are in distress. A little bit about us. I'm Stacy. I grew up and I have family still in the Appalachians in Southwest Virginia and East Tennessee. I'm a crisis intervention specialist. I specialize in trauma recovery and disaster and crisis response work. And I'm the executive director of a growing nonprofit called Crisis Care International. And Crisis Care International, we've been working globally. We've been quite active in Ukraine since the war started and several other places. Most recently, we spent several months in Morocco after their earthquake, but we're sad really to be responding to a disaster in our backyard. But we're thankful to be here, and I am the proud mom of 5 young adults out there. Phil?
Yes. Hi, I'm Phil Monroe. I'm a psychologist in the Philadelphia area. I own a practice and lead Langberg Monroe and Associates. Some years ago, Dr. Diane Langberg and I started Global Trauma Recovery Institute, which was designed to train people who are wanting to enter cultures not their own to better understand how to help with trauma needs without creating cultural problems, and understanding that they weren't trying to necessarily do therapy, but to help local leaders to be better equipped, like this, what you're doing today, to be better equipped to take care of their own community members. And so that's what I do here. And I'm the vice chair of CCI as well, of their board.
So by the end of this workshop, I want you to learn to think like a crisis responder. So even if mental health is not your area of expertise, and let's face it, even if it is, that doesn't mean that you've been trained in crisis response. But whoever you are, whatever work you are doing, we never know when we will be called to help someone in crisis. It might be a friend, a family member, even a coworker. Over and over again, what we hear when we go to communities after disaster is, I wish I'd known what to do before it happened, right? Maybe you can think of a time when you were called on to help and you just felt really unsure what to say or do. And maybe even in this present disaster situation, you've already stepped in as a helper and you're feeling really overwhelmed with what you're seeing and experiencing, and maybe feeling at a loss of how to help. Well, you're in the right place, because today we're going to cover the basic things you need to know for responding effectively to people in distress. So thank you for coming. All right, to start out with, there are certain fairly universal phases of disaster, and these are emotional, psychological phases or stages that we're going to talk about, and it can really help us as responders and also survivors to understand what we can expect over time, okay? First of all, there's that pre-disaster stage, and this is important because one of the factors that it affects the impact on individuals and communities is warning or no warning. In the case of this hurricane, there may have been some warnings, but nothing prepared people living in the mountain regions for the true impact of this storm. Now, in the pre-disaster phase, the threat rises, right? And then the full force of the disaster hits. And the greater the scope of the community disaster, the destruction and personal loss of lives, of property, the greater the psychological impact. So I'll say that again. The greater the scope of the community destruction and personal loss, the greater the psychological impact. It makes sense, right? Um, so that this this impact stage, what you're going to see here is a lot of panic, shock, um, maybe some hysteria as people are feeling stunned and confused. And this is in the worst part of the disaster, right? It's a state of disbelief. Um, maybe people are frozen, maybe they're unable to act. And we're going to talk about that later, like what happens in the body physiologically, this fight, flight, freeze response. And so this in this part of the this stage of disaster, when the impact happens, there is a lot of anxiety. The focus is on survival, and physical well-being. A lot of anxiety about separation from one another, from family members, and many people experience feelings of guilt and blame later for how they responded during this impact stage. Okay. Next, you'll see here the heroic stage, and it kind of climbs to a peak. And this is the stage we're in right now. We're about 8 days, a little over a week out from the impact of the hurricane. This is when a lot of adrenaline induced behavior. So people spring into action, right? You see people rescuing others, people doing things that take a great deal of perseverance and strength and fortitude. This is a time where there's high activity, but often, especially in those first few hours and days, low productivity. So, in other words, people are scurrying around trying to do things, but it's not necessarily effective or efficient because it can be very disorganized and chaotic in those early days. And some of you have probably already experienced that. Distributions of food supplies, NFIs, and even rescue operations in those first few hours and days may not be efficient, may be chaotic. Sometimes there's a lot of unsafe, risky behaviors, even from survivors. And this is just an example, working in earthquakes in the past. I often would hear debriefing survivors, for instance, that after people leave the home, they go out and then somebody runs back in to get something, right? That's an example of really risky behavior. They're just not thinking. They run back in to like save someone else or, get the family documents out or something, and the home collapses. So they were really just acting instinctively for something and not really thinking. So some of that risk assessment, ability to assess risk is impaired during this time. And you're gonna see how that ties in with the physiology of trauma. When people are in that acute traumatic stress stage, there's a part of our brain that goes offline, the part of our brain that helps us to reason and think. And so if we don't slow ourselves down and we're just acting instinctively, that can sometimes be to our detriment and result in injuries and death for initial survivors, or first responders who go in to help. And that's some of you who work in emergency response services like I have, that's why they drill into us, scene safety, always survey the scene. Is it safe? Because when you're operating on adrenaline, you don't think about safety unless you intentionally slow yourself down. And that's where people are often operating in the first hours, and maybe even days. And this can extend into that honeymoon phase. So a honeymoon phase is exactly what it sounds like. In a good way, though, the productivity and efficiency starts increasing. So organizations and community groups, they start teaming up. You'll see a lot of collaboration here. Altruism is high. People want to help. They want to get things done. Lots of people giving their time and resources. And there's a kind of bonding that goes on in communities during that honeymoon phase, and it's very motivating. There's still a lot of action here. People feel useful and they're energized. They still have a lot of adrenaline. You're still seeing people be rescued, so there's still survivors in a disaster. So lots of action. They People keep going, and they keep going for a long time because they have adrenaline. They also have a lot of cortisol, so that's stress hormones. But they can go without sleep, food, and rest. Eventually, though, they're going to hit a wall. And something for you to keep in mind, those of you that work in the mental health field or in crisis intervention, is this stage between the honeymoon stage and when the disillusionment stage starts. This is when communities become more open to mental health support. Prior to that, during heroic stage, communities are all about rescue, survival, and just meeting basic survival needs for people and rescue and recovery operations. But after, once the honeymoon stage happens, and then after, and we begin to move into disillusionment phase, um, usually that's where communities start noticing their need for some psychosocial support and they're more open to it. There's a time for different types of psychosocial support, and it ties into these phases. So keep that in mind. Okay. In CCI, we do a lot of crisis debriefing with people. We don't do therapy in disaster zones. We do crisis care. And there's a reason for that. And Phil's going to talk about that later. So what's coming is this disillusionment phase. And this is where people really start taking stock of what they've lost, what they've truly lost. It starts sinking in. And the other thing that sinks in is as the weeks and the months go by, the big organizations start pulling out and they put resources in other places. And so people begin to feel a little bit left behind, and they start taking a stock of how much they need, what resources they have or don't have. And this is where you might see communities, you might hear people being really angry because of what they're not getting compared to some other community that's getting more resources in some way. And of course, some of these stages can overlap for different people, but that disillusionment phase is also where people start feeling the impact of trauma triggers. And here's an example of that. So in places I've worked where there's been hurricanes, in the communities in the weeks and even months later, when it starts to rain or you can feel the wind picking up, you'll hear the kids start crying. And it's a trauma response because of what they've experienced. So there's a fear response to a trauma trigger of weather is there. So financial pressures increase at this stage. Fatigue, exhaustion sets in. Family discord increases because resources are strained. There's a lot of stress-related health problems. Phil and I saw in Ukraine, as the war progressed, you saw a lot of stress-related heart attacks in younger men. Compassion fatigue sets in for responders, and you're going to see survivors feeling more and more hopeless and depressed. Also, the seasons are going to change. And so we're heading into winter now in the mountains, and that's going to make a big impact on people. Now, pay attention to that 1 year anniversary mark. Okay. Mark your calendars for September 27th next year and the days that lead up to it. No kidding. This is where we'll see an increase in individual and community distress. Usually we see increases in depression rates, even suicide rates. The anniversary reactions are normal and real after disaster. And something communities can do is to do something to prepare and honor people at that time and just help them maybe remember what happened and come together and look ahead. So different communities sometimes plan not celebrations, but ceremonies. So a time to remember and just acknowledge that anniversary is a hard, hard time for people and community. And finally, the reconstruction phase, that stage takes a time for people to get there, but that's when they start to really process and work through their grief and loss, come to terms with loss and a new way of living and adjusting to their life with all the things they've lost and or without the things they've lost. And there will be setbacks, but communities, people, they rebuild in different ways. And this is where they begin to notice their own and appreciate their own resilience. So there are no set time limits for these stages, and they can vary for individuals and for communities. But this is what we've seen, and other research and organizations have borne this out. Is this pretty predictable um, phases globally and kind of universally? So, all right, Phil, do you want to comment on any of those
No,
and
I
talk?
think you hit them very well. Just to remember, there are different kinds of things that we might do depending on the phase, and one community might move more quickly through a phase. So you might see someone going back into disillusionment after anniversaries, where you see maybe some things that they thought were going to happen that didn't turn out to happen that way. So there's
Mhm.
no one size fits all, but it's helpful to know because we tailor the kinds of responses we might have to where they might be in their phase.
Yeah, that's a really good point to make. So one of the things for CCI is we don't just go into one, we never go into a community uninvited. If a community invites us in to support them, we're paying attention to what phase they're in and what's appropriate um, for how to support. And as time goes on and they do move into that disillusionment, but then the reconstruction, that's when we're going to start talking about grief. That's when we're going to help do maybe offer some psychoeducation about trauma and grief and helping people do things, practice lament. And there's some great programs that we bridge people to. The Trauma Healing Institute has a great one. But we really pay attention. Where are they in these phases? Some other things in the initial stage of response that you're going to want to consider these important things. First of all, whenever you respond in a crisis, and the crisis is when people are overwhelmed beyond their ability to cope, right? So crisis is not just a one-time event. A crisis incident or a crisis event happens, but then crisis is kind of a longer term situation that people find themselves in, and they're just struggling to cope. So what happened? And in this case, a natural disaster, and it was a not just community wide; it was across a whole region. You can also ask questions like, okay, what happened? Did they just receive bad news? So kind of drill it down a little bit. Have they just experienced or witnessed something really traumatic or overwhelming? Are they a first responder and they just responded to people involved in a really traumatic event? So what kind of support did they need? So it's going to help you, it's going to help you tailor your response, right? When you understand what happened. Um, who all is affected? Is this, in this case, like whole regions and communities are impacted? Um, is it in other situations, maybe it's just an individual or it's just one family or it's a small community? Maybe, again, like we have whole regions, many communities have been affected by this disaster. Now, we want to ask about some special factors like age, right? And keep in mind, as you're thinking of this stuff, you're thinking about vulnerable populations too, the elderly, people who are homeless, disadvantaged, people who have cognitive and physical challenges. So you're thinking about children, elderly people, everybody in between. You're thinking about um, male, female, what's their gender, ethnicity, language, because do you have somebody that speaks their language that can share information with them? It's very isolating to be in a place when there's some terrible thing going on and you can't understand because nobody speaks the language you do. But I really want to drill into culture here because I grew up in the Appalachians and I know that the Appalachia is they there's a unique culture there. And so I have a very special guest who's going to speak to this tonight, and it's my dad. And my dad is a retired state trooper, Virginia state trooper who lives in Southwest Virginia. Actually, he lives on the Tennessee side of Bristol now. Um, but Dad, can you hear me?
Yes, I can.
Okay, so my dad's name is Mark Sutherland. And again, he's a state trooper or has many years being a state trooper, and he's retired now, but he still keeps dipping himself back in. So he's worked as a first responder for a long time. And we had a great conversation last night about our culture, our Appalachia culture. And so I want to ask you, Dad, if you can kind of speak to that as people are on here who might be, maybe they're not from the region. Um, Tell us a little bit about the culture, because you grew up in Hayside, Virginia, so that's way back
That's
in.
about as deep in Appalachia as you can get.
It is.
No red lights, no four-lane roads. We had a lot of disasters. We had a big flood in '57 that destroyed the town, and it devastated the community. We only had one store, and it was gone. We didn't have any help, and everybody had to stick together and pull each other by their bootstraps and help each other. And that's the way we got through it. And I think that is the essence of Appalachia culture and people. They help each other, whatever needs to be done. You help your neighbor. You don't care about what you do. You just help your neighbor in any way you can.
Yeah. And what happens? So what happens, Dad, when somebody has to receive outside help? How do they feel about that?
Well, when we grow up in a real culture that is uh, just in my little neighborhood, it was all family,
Mm,
and you had to learn to trust people that you worked with, that you lived around, and someone coming in from outside, they you had to trust them. They had to earn your trust. If you just didn't trust them right off the bat, you had to work with them or get someone that trusted them to talk to you that you trusted.
hmm.
That was a big thing with people coming in out of the area. It was not trust right off the bat. It was something that you had to earn
Yeah.
through the Appalachia culture.
And that's really important. I really think it's a big, um, vital thing for people to think about as they come in, that they may also not want to necessarily take help or aid. Is that right?
Yeah, Appalachia people are real proud. I mean, if they have to really be desolate and down on their luck to help and have outside help. Uh, most people that have lost everything, they don't have anybody else to turn to other than people that want to help, and that's really uh, hard for them to because they've been brought up to be dependent on their own, and it's really hard for them to accept help from strangers.
Yeah. And I imagine for a lot of people in those mountains that are having to accept help and who everything they have has been destroyed, it's very demoralizing.
Yes, yes, it's the thing that everybody grew up with was taking care of your family. That's all you grew up doing, and that everything you did was to take care of your family. And when a natural disaster hits that you don't have any control of,
Mhm.
you can't control your family, take care of your family, and that's a big heartache on you, big stress, a lot of stress for you. So
Yeah.
I'm sure they really uh, would like a lot of help, but it's hard for them to accept it.
Yeah. And that's going to be important for us to remember is people need help right now. They appreciate it. I think they're very grateful for it, but there's a loss of dignity for people in having to receive so much um, right now. So we want to be respectful in the way that we approach folks. We really want to come alongside. We don't want to do anything that's patronizing to them or look down. And I know, Dad, we joked about this, but people sometimes, the stereotype of the hillbillies. Um, but Appalachia people are really smart.
And they are smart. And like I said, they can do anything. I mean, uh, when we grew up in the 60s and 50s and 60s and 70s, you didn't have all the plumbers and electricians that you could just call. You had to do it yourself. And uh, my dad, he could build a house by himself just by being self taught. Uh, and you didn't have anybody you could depend on. You had to depend on yourself or your family. So that goes a long way in
Yeah.
being who you are.
Now, Dad, you mentioned too something to keep in mind about first responders, and you've been a part of that community for many years, and you still are real active in it. Um, so how can we, when we're coming in for crisis debriefing and things, what do we need to keep in mind for first
Uh,
responders?
I think it's imperative that you get somebody on the ground from the local community to actually take you in and let let the people that you're assisting know that you're there to help them and not be condescending to them or look down on them, that you're there to help them in any way that they need,
Yeah.
and get somebody that the community trusts, that you can go in and work with. I think that would be a big help to you to do that.
Yeah, that's great. Thank you, Dad. This has been really helpful. I think everybody would agree. And
Thank you.
thanks for sharing.
You're doing great work. I'm
Thank you.
proud of you.
Thank you, Dad. So, such good information there, and just about the respect for the people, respecting the culture and traditions of the Appalachian people, and then just thinking about what are the resources available, and find out, because we are a very resourceful people. And if you go when you go into places, you might be surprised. You might think you know what the need is, but actually that need's already met by the people. And so there's something else they need. I don't know. Phil's going to speak to that a little bit more.
Yes, and thank you, Mr. Sutherland, for your insights. I can't stress enough also what you said about making sure that whenever you're going someplace that is not your community, that you're working with a bridge person, someone who does know and who not isn't just going to shake the right hand so you can get in there, but actually can be your educator and your support. There's going to be mutual sharing of information. And if you're going to have any kind of effectiveness to know what the needs are and what the goals are, you can't come from outside thinking you already know what those are. You're going to have to learn that in dialogue. I know there's a number of people here who are mental health professionals, and it's great. I love that my kin are interested in helping. Um, but it's also good to remember that we mental health professionals aren't always trained well in knowing how to respond in a crisis, because we start thinking about therapy and therapeutic intervention. And while crisis care is a kind of therapeutic intervention, it is not what we classically think of as therapy. And so we want to be thinking about what is it that we are going to offer? What is it that we can do? And you'll be learning some more things about that coming up in the second half of this webinar. But we really want you to be thinking that you can't come with maybe the resources and the tools of therapy and just assume that we're just going to find a corner, under a tree near a road that we're going to be doing therapeutic interventions. Some might even be thinking about, hey, if somebody has the internet, I can provide telehealth from another location. And there may be some places for some crisis debriefing through that way, but generally speaking, in order to understand what the local needs and goals are, you're going to need to have someone who is going to be able to help you understand that. Far too frequently, we have heard from groups, whether they're in Manhattan after 9/11 or they're in this region that's suffering right now, or someplace like Rwanda or the Ukraine, is that outsiders come in thinking they have the tools to assess and determine what the needs are, and that the population there are ignorant of them. But in fact, actually, they're the best experts. And so we're looking for them to help us shape whatever it is that we might be able to bring. Okay, I want to go a little further here. It's probably good to just set a foundation of what is trauma. Probably most people on this webinar know this already, so we won't spend as much time on that. We have other trainings and materials that would take you further. But as you know, trauma is not as unusual or rare event that we maybe once thought. You know, when we first started hearing about PTSD and trauma, the image was of somebody from the military coming home with some sort of shock. I have colleagues who are a bit older than me who remember when PTSD was the first time being made as a diagnosis. So it's still in our lifetime, really, that this is fairly new. And yet it is a conversation that's happening a lot. And that's because, especially of our understanding of adverse childhood experiences. So 70% of the population experience in their lifetime um, a traumatic event. And we'll be talking about what that is in a second. But if you look at adverse childhood experiences, 60% of people have experienced at least one. What are these adverse childhood experiences? That's violence, maybe in the home, in the community, abuse, neglect, sexual assault. There's a Philly ACEs study that was done after the big ACE study out in California. And that looked at things like racism, discrimination, having a parent in prison, poverty. There's a variety of things that can really affect somebody's life. And 1 in 6 people report 4 or more. And the more ACEs you have, the more likely that you're going to have a shorter lifespan, that you'll have more health complications, things like diabetes, hypertension, and cancer. More likely to divorce, more likely to be imprisoned yourself. There's just a cascade of effects, unfortunately. And you see there the sexual assault statistics, probably 1 in 3 women and 1 in 6 men have experienced unwanted sexual contact by the age of 18, and most do not ever tell anyone about it. And so they carry around in them this hidden wound. So what is a trauma? Well, it's an invisible wound. It affects every part of us, ourselves, our families, our communities. And how do you know if something's traumatic? Because we do use this word maybe sometimes a little bit too superficially. Oh, that was traumatic for me, and it was really just a passing irritation, a passing shock. But usually, something that goes into a chronic trauma reaction is something that had overwhelming fear and helplessness, the inability to do something about it. Often there's isolation as attached to that as well, a sense of I'm alone, there's nothing I can do. And that shock continues and reverberates in their life for months. It may not show up immediately. It may show up 6 months later, a year later, or maybe when you hit an anniversary or you have children about the age that you experience that. It is really not about the event. Obviously, events happen. It's about the experience or the perception. So that's why 3 people might go through the same event and have 3 very different responses to it. Trauma tends to have a kindling effect as well. That means the more sticks on a fire, the bigger the fire. So the more experiences of trauma, like we saw that with the ACEs study, the adverse childhood experiences, the more experiences, the more likely you may have a chronic challenge in your life. So that's what trauma is, an invisible wound. And it's really about that experience. Let's go a little further here, though, into this. And Stacey, I'll have you talk about the physiology and how it affects our bodies.
Yeah, so as Phil said, we call trauma an invisible wound, and yet there are some very real physiological processes that occur in the body when we experience trauma. And this is called psychological shock. And psychological shock, also known as acute stress reaction, mental shock, it's a physical reaction to a traumatic, stressful, or really terrifying event. And when someone experiences a traumatic event, or it could be a reminder of the original event called a trigger, there is this unconscious response that occurs in the brain and throughout the body. So let's talk about that for just a minute. And this is so important for you to know as you work with trauma survivors. It will help you understand some of the things that you're going to see. So the brain senses danger, right? And it could be the perception of danger, or it could be actual real danger. The brain senses danger and it sets off this little special alarm in the brain. And when that happens, chemicals like adrenaline and cortisol flood through the body to get us ready to survive. So the sympathetic nervous system is activated. And when that happens, there's a few things that go on. Oxygen gets depleted in our cells, circulation decreases, our blood goes to the core of our body to protect our vital organs. Our digestion slows down, and our things like our prefrontal cortex, this reasoning part of our brain, kind of goes offline. We could have a very strong fear reaction, and instinct takes over. And that's where people get the response to run away or to fight. Sometimes under really intense stress, we freeze up or become sort of immobile. We could even faint and collapse. But the effects of this chemical cascade through the body, they're very real, and they can last for an hour or more, and they'll start over again whenever the brain gets a new danger signal. Whether it's real or perceived. So that's why someone can hear a storm coming, and because they have been in a past event, like a big disaster like this, where there was a storm, maybe that the sound of rain sends that whole process happening in their body, and they feel themselves tense up. So here's some things that happen. The prefrontal cortex goes offline, which means cognitive processes are slowed or diminished. We can get tunnel vision, constriction. In other words, we can't see, we might not even hear things around us. We just see what's in front of us. Adrenaline going through our body is going to make our heart race. Our hands and feet can get cold. You probably recognize some of these things in your own life when you've been under a lot of stress. As digestion slows, you might feel nauseous, lightheaded. Some people get a surge of energy, and they can even, that adrenaline can even propel them for hours or days. Other people feel very fatigued, and just lose all their energy and feel very weak. Our motor skills, so like we might not be able to grab things or pick up something. It just is a very, very overwhelming experience for somebody. If you've ever known anybody that has said they had a panic attack, they might describe some of these things. And in the moment, it can feel like you are having a medical emergency, even. And it has repercussions on even how people behave and things that you'll notice. But what I really want to emphasize here is that this is a normal physiological process that all humans experience. And Phil and I have worked all over the world, and we've seen it in every culture that we've worked in every country. We've seen these same types of physiological responses to trauma. But I emphasize the word normal. It's normal. It might take a couple hours for this to calm down when a person feels safe. But it can make somebody feel really terrible and really crazy. So you might have noticed these in yourself at some time when you went through some distressing events. Maybe you even thought, what's wrong with me? Why can't I just pull myself together? But now maybe you understand why it can be so difficult. And understanding this can really help us be more patient with the people that we're trying to help. And we're going to give you some practical ways that you can help calm this very distressing response.
Yes, so you may have heard also, because it's being talked about fairly frequently these days, something about polyvagal ladder. This is another way to visualize what's happening in the body, taking what Stacy just has talked about and giving you just another way of thinking about it, both for sort of assessment as well as for ways that you might intervene with yourself or with someone else. And this is just to think about a ladder. If you're at the top of the ladder, this is the place where you want to be. This is where you're in your safety state. You feel connected, calm. You feel creative. You are seeing people and you want to be seen. So you think about maybe walking into a room with friends and you're excited to be there. You want to hear what people have to say. You want to share something with them, and you just feel at ease. But when a trigger happens, you might find yourself in this first stage of fight flight, which is you might find yourself anxious, afraid, nervous, angry, impatient. Maybe you're pacing. Maybe you've been in that state, and all of a sudden you start trying to order things or clean things, or you just can't sit still. And that might be happening to someone. Actually, not all of these, being in these various phases are bad. In fact, it's a way that our body is telling us and signaling to us there's something wrong and it needs action. In fact, some people who are in the practice of caring well for others, in that they are using sort of that adrenaline to be able to do things. So it looks really good in the short run, but in the long run, actually, they may end up crashing their adrenal system over time and later on have a real struggle to not be in that fight flight mode. They don't know how not to. Maybe you've seen somebody who did ER work or first responders, that they almost don't know how to function without a crisis because their bodies are so used to being in that state. If you are in that long enough, you may end up going into something that's called the freeze or the faint mode. And that's where things are slowing down. Your body is really shutting down some of your extremities in order to keep the basic things like your heart and your brain going. And maybe even your brain is going to go offline because the blood is shunting straight to the heart to try to just keep you alive, heart and the lungs. And so you might see somebody who is really in this faint, cold, collapse, shut down. They don't want to open their eyes. This can be helpful for us to know, to be able to evaluate if we are maybe working in a disaster zone or with some folks who are in crisis, because in each of those places, you would use different skills and tools. For somebody who is having a hard time sitting down, you might be offering them a cool drink. You might be helping them to slow their pacing down, helping them to slow some of their breathing down. For somebody who's in more of the freeze and faint mode, you might actually be putting a blanket on them and speaking in gentle tones and maybe handing them a hot cup of coffee or tea in order to just literally begin to warm up their bodies. So we won't spend a lot of time talking about what helps here. And in fact, the person that you're helping is the best expert when they are in a more safety state. What helps you a little bit? And it might not take you right out of that way of feeling, but it might help you 10, 20, 30%. And you're helping them to build a idea of what can I do and what can others do for me when I am in a triggered state like fight, flight, freeze, faint. So just another slide here for you to look at. Again, if somebody has a chronic trauma reaction, or if they actually are getting close to meeting the diagnosis of post-traumatic stress disorder, there are things that you might see, 4 types of symptoms. And even those who don't meet the criteria might have bits and pieces of these. We call it subclinical, meaning they don't meet the criteria, but they're still having one of these symptoms. So you've probably heard of these, but the first one is about reliving. This is where I'm experiencing again the same sensations of the original traumatic experience. Can be intrusive memories. Can be like having daydreams, nightmares. It may not even have conscious thought with it. It may just exist in the sensations in my stomach, in my legs, the way I felt then and there. So these are reliving. And of course, no one wants to relive. They want to shut that down. So they do a lot of avoiding. And you'll start to see a lot of avoiding. I don't go places that I used to go where that trigger it is. Maybe I don't want to, when it starts to rain, I go and I hide. I don't want to hear the rain. Or if I hear running water, I don't want to hear that. And so I'm trying to get away from that. So they're avoiding reminders. Some people will avoid by overworking. Maybe they'll use addictive substances, or maybe they will have risky behaviors that they tend to do. Anything to keep myself out of that helpless, hopeless state. But the avoiding doesn't really work. And so it leaves me in a on alert or hypervigilant state. Always my body, whether I know it or not, is preparing for the possibility. Some of you know, and you've been watching your weather forecast, there's another tropical storm in the Caribbean making its way and likely to make landfall later this week in Florida. And I'm rest assured there's probably people who are checking the weather forecast on repeat to want to know, is it changed? Is it coming towards me? Is it coming here? What do I need to do? This is maybe a person is their vigilance makes them just irritable and impatient, and so jumpy and touchy about anything. So somebody comes up and just taps them on the shoulder and they whirl around ready to sock somebody. That's what it might be. If you live in that state of those three, of reliving, avoiding, and hypervigilant, then it's not surprising then, because something significant feels like it's happened to you, that you can never get back to the way it was before the trauma. And so you end up developing, very normally, very naturally, a negative outlook. You don't know how to get back to life before the event, before the experience. Life feels unpredictable. It feels there's indignity, just like Mr. Sutherland was talking about, this sense of every time I'm receiving help or I have to go get some more help, I may feel that way. There may be a great sense of injustice that's happening as well. And for many of us, we begin to feel that life is going to end soon. And so those are the four symptoms that tend to come with a chronic trauma experience that's taking place in our bodies.
And we just want to emphasize it's normal, that those things are normal responses, just like the physiological responses people have. And you might be surprised how important it is for people to hear that, because a lot of folks don't know that those are normal responses after a traumatic event. So when we encounter people in crisis, it is not our position, our title, our degree, our diploma, our certifications that will help them. I've never gone to a disaster situation and somebody asked me what my degree was in. The most helpful thing is our presence with them in their pain. We show up, right? In a moment of distress, we can actually bring a lot of calm and a sense of safety to people, but there's more. I used to think in crisis response that presence was everything, but it's not. Presence needs more, needs knowledge. It helps us to be effective in crisis response if we know the basics of trauma, the basics about what trauma is and the normal trauma responses, which are all the things we just covered. Besides understanding normal trauma responses, there are also certain principles and skills that can guide us in what we do to help. So those three things: showing up, be present, and then know the basics. And that's why you're here today. And I'm really glad that you cared enough to join us and to learn these things. And then the skill. So doing those things that are helpful and effective for the beneficiaries or survivors. Being trauma sensitive means a few things. So it means that our practice is actually aligned with our knowledge. And it means that in the long term, long-term peer support structures and programs can be created through this lens of trauma sensitivity so that they're safe and effective ways of helping people, not just in the immediate, but going forward. And it's like my dad mentioned on here earlier, people know and trust people around them and in their communities. And so how can we help encourage that and come alongside, not in a way that's patronizing, but in a way that's sensitive to the terrible thing that survivors have been through. And a lot of the first responders, they're also survivors. And so how can we be sensitive to them that they've also been through a traumatic event? So let's talk about these 8 essential pieces, these principles and practices of trauma sensitive care. The first one, it's foundational and it's about safety. So it's the foundational element of trauma sensitive care. And just keep in mind, Phil said it, trauma involves intense fear and helplessness. And those 2 elements. So if we mitigate some fear by increasing a person's sense of safety, that's essential for them to begin to recover. Now we can think about actual physical safety. Is the person in danger? Are they a danger to others? Again, trauma is overwhelming, but even in these situations, we can gently but firmly come alongside and lead, right? So you can give clear, brief instructions about what's needed, just being careful to explain what you're doing, communicate clearly to someone if you're trying to come along and assist them and you need them to move, for instance, from one place to another. You wouldn't just come and grab a person. You wouldn't come in and bark orders at them. You would just calmly ask them if it's okay if you can move with them to another area that's more safe. So something like that, just being careful that you're watching out for the people you're working with. You're watching out for your own safety first, but you're considering, okay, physical safety. Are they in an area that they're still in danger? And then other kinds of safety, emotional, psychological safety. We don't want to do things that feel like we're coming in parenting people. And Phil will talk about this later. We want people to feel empowered, but we also want to build trust and just paying attention to how we hold ourselves, how we speak, just being aware of any postures that we take that could be perceived as threatening to somebody. When we are paying attention to safety, like confidentiality, I mean, is their privacy safe? Are people videoing them? Is this getting recorded? What about things like do they have medical care? Do they need emergency first aid? Are they, what is most important for them right now? Are they missing a family member and they need help locating that person? So, and we might have the best intentions, for instance, for helping, but we've just got to be so careful. We sometimes get very private information from people as they begin to share and open up. And that is a privilege to hear people's stories. But part of what makes us safe is that we keep their information private. And in our work, the things that we are mandated to report would be if somebody's going to hurt themselves or someone else, or they've hurt a child or an elderly person. But otherwise, I'm going to keep their business private, right? And just giving people control of their own story so they feel more empowered. So if you keep in mind those elements of trauma that Phil mentioned of overwhelming fear and helplessness. So what can we do to reduce feelings of fear from their perspective? And it's their perspective that matters. So we might think something's safe, but if they don't feel safe in that moment, then that's what we need to attend to. The next thing is communication. So communication in crisis, good communication in crisis is so important because good communication is a way that we can build trust and create safety. But poor communication can very quickly destroy trust and it erodes a sense of safety that people have. So some ideas for this: when you communicate with people, clarify their needs. So if you ask them what they need, reflect that back to them to make sure that you've understood. And keep in mind that the way you communicate, the tone that you have, the your the voice that you use, the way that the volume that you speak in, a way that you don't talk down to people, that it's not patronizing. And we want to tell people the truth about what's going on. Um, just knowing that, sorry, I skipped ahead here. Reflecting back to them, what did you hear that they need, and what are next steps? And you're giving them information as you have it. You're not withholding things from them, because people know if you're withholding information. Something else to keep in mind: if you're somebody who is taking death notifications, or you're notifying someone of some serious injury, or just basically if you're bringing bad news, this is important to remember some of those physiological things that we mentioned. Ask the person to sit down first, and just be prepared for whatever reaction you get. I always stay an arm's length away from someone when I'm delivering bad news like that, because people have been known to lash out and smack or punch the messenger. Um, and I always remember the person is just, remember, they're acting out of instinct often in that moment, because you're giving them some really shocking news. So keep that in mind and just be prepared. Share updates honestly. Again, don't withhold information unless you don't have permission to share it. Don't give graphic details. Just be factual, simple, brief. And don't discount how stressful it is for people who are in a new environment. Maybe they're in a shelter somewhere. And they don't have the normal supports that they're used to. It's very, very stressful, and people can be feeling angry and just emotionally overwhelmed, and that's normal, and it's to be expected. And we want to respond to them in a way that's non-judgmental and without criticism. The third thing is stabilization. So we've explained earlier about the physiology, and so because of that, and Phil talked about the polyvagal ladder, we want to help people climb back up that ladder so they can get in that more safe, connected state, right? So one of the things trauma does is it kind of thrusts people into the past of what happened, but they are also sort of living the future of what if it happens again. And we want them to be in the very safe, hopefully, here and now in the present. And so we call those grounding skills or techniques or whatever, but it's just helping people get stable. And it could be something as simple as some deep breathing, because again, it's nothing magical. It's just the body needs oxygen. And in that psychological shock that happens, that oxygen gets depleted. And so if you can help somebody just take some deep breaths, maybe go for a walk, start moving their body, give them water, because drinking water helps flush the endocrine system of those nasty hormones, those chemicals like adrenaline, cortisol, and just helps people get regulated. Help people use their senses, looking around, smell something, chew on some gum that's a minty flavor. So these things all help us with regulating and getting this physiological process kind of calmed down and under control. So that's all stabilization is. It's pretty simple. And like Phil said, these interventions are they're not clinical. It's things that people can even tell you what will help them. You can ask them, would you like a warm drink? Or would you like to go for a walk? So simple. We're just shooting for simple here. Now let's consider assessment. So assessment in crisis intervention is ongoing. It starts from often when you first hear about a situation you're going into, you're already assessing and getting the info that you need, right? So what do we mean by crisis or psychological trauma assessment? Well, we're not talking about clinical tools like some kind of standard assessment tool. and getting scores and that kind of thing. What we are talking about is going into a scene, and there are certain things that we're going to be looking for. The first thing when we go on a scene in a crisis situation is safety. And whose safety are we worried about first? You are worried about your safety first, because if you aren't safe, you can't help somebody else be safe. So assess, are you safe to be in that place with that person? Right? We can't help somebody else if we are injured or dead. So is it safe for me to be here? And then the second thing is the person's physical safety. Are they in danger? Are they a danger to other people? Are they, we mentioned this in safety a minute ago. Do they have medical needs? Do they have physical needs? If someone seems to have altered mental status, they're just not talking right, something seems off, you can't just assume it's a psychological problem. It could be a medical problem. It could be low blood sugar. Never, so don't assume. Get the information. You're also remembering that you're checking to see, like, how's the person doing with their normal activities? Are they able to take basic care of themselves? Are they responsible for young children? Is it okay for me to leave this person alone? Can they take care of these kids? Can they take care of the elderly people in the home? Can they take care of their own needs for food and survival and the things that they need to do? So we're assessing that, because if they can't, then we need to direct them to the proper care that they need. And we're assessing the coping strategies that they're employing, if any. So what's helping them? Are these healthy coping strategies? Are they effective? What is their support system like? And in situations like this, in communities, the things that have been destroyed, the things that people used to find supportive, the places they used to go for help are often destroyed. I mean, it could be their church. That's where they used to go every week, and that's where their community was, and they got support. And now their church is destroyed, and all the people are scattered. And that's a big deal to them. So find out about their support system, what resources they have, and what resources they need. And look, throughout a crisis response, we are continuously evaluating and assessing, and needs change. Survivor needs change. So we have to keep checking in. And we also have to learn the ways that we can practice self-assessment. Am I okay? Am I the person to respond to this? Should it be somebody else? Do I need to tap out for a little bit? That self-assessment also has to continuously be going on. You have to keep checking in with yourself and how you're doing.
Okay, so far we've given you 4 of the trauma sensitive care principles and practices, and you can see that they're in some ways rather simple. They're simple when you think about creating safety and communicating, and even doing things like saying who you are and why you're there, and you are also doing some basic assessment. And each one, however, can be highly complex, right? Depending on the situation, depending on how well you understand the context. It may require that you, again, have somebody on the ground who is helping you understand something that would seem really unsafe in your world might be really normal here. And so we are coming as students and working with the people that are on the ground and helping to understand what's happening. So again, it can be simple, but remember this: you trust yourself, right? You know yourself to be a safe person, but the community that you're entering doesn't know that yet. And so this is why it requires us to be doing that self-assessment and to be thinking about, I wonder how I'm coming across. I'm wondering if I'm as safe or being perceived as safe as I think I am, right? So again, very simple, but very necessary.
Bill, I think at this point it's a good idea to also speak to that about as you're doing the self-assessment, maybe what would you say might be assigned to somebody that that maybe they shouldn't be taking on this response. Maybe they're not the right person.
Right,
Or
that's a really great
timing.
question. We'll talk more about this a little bit later when we're talking about self-care, but sometimes you've been through the same experience and you might think, well, I really understand what it's like to help, and you are the right person. Other times, you might look to the fact that you struggle with the same things and you're being triggered in your own sensation. You're having nightmares, you're having flashbacks, you're feeling all of those same things. And you might want to ask, am I really the right one? Could I do something else? And sometimes we do this all or nothing thing. Either I'm going to go help and I'm going to be really helpful, or I'm helpless. And the reality is, when we think about this particular, especially the particular crisis here in Appalachia, there are so many different kinds of ways you might be able to help. Some would be really up close and personal, and others from a distance, where you might be helping to sort things that are being readied to take in, food and medical supplies and things like that. And or you might say, you know what, I think I'm better at the reconstruction phase, or I'm better when it get to the disillusionment phase. Right now we're in the heroic phase, and my resources can come in when I'm fresh, and when other people are feeling really ready to tap out, I can take the baton then. So that's the thing I would say. I don't think that's a specific answer to you, Stacy, but it's a recognition that my own history might be coming up here. And just because I have experience doesn't mean I'm the right one, because I might be too taken up with what's happening.
I think that's great. And we are going to talk more about self-care at the end.
Okay, so let's look at our last four skill set and we'll go through this. And again, if you have any questions and you want to put them into the chat, we're monitoring that and we'll try to answer them as we go. So the first four really were about creating a space of safety and calmness to try to help people's bodies calm down, to help them understand what's happening and to normalize it. And that's really what we're going to talk about with these four as well. But the first and most maybe important of all 8 skills is giving people choice. You see, when a crisis happens, we are helpless. We can't stop it from happening. It happened. We, by definition, were powerless to do anything really to stop it from happening. And so part of the healing journey and the repair and the part that helps maybe from having a crisis, keeping from a crisis turning into a chronic trauma experience, is to restore a person's sense of autonomy and their choices. So even small choices, you might be having the opportunity to meet with people who are first responders and they are coming off of 20 hours of work and they have an opportunity and you're supposed to be there to talk to them. Well, the very first bit of choice was making sure people know they don't have to talk to you, and they might not be ready to do that. They might just need to go to sleep and to try to prepare for the next day. So when we give them that permission without any shame or guilt, you are in some ways restoring their choice and giving them empowerment. They might even make choices that you don't think are the best. And that needs to be okay, because you cannot control somebody into healing. It doesn't happen. There are no such things as benign dictators in trauma care, because it's taking control from somebody. So think about that. What kinds of choices? We have an array of options. Do you want to go sit over there and have a cold drink, or do you want to come over here and help us sort something, help somebody feel a little bit more like they have something they can offer? Would you like to walk, or do you need a place to sit in shade? These are some of the kinds of choice and empowerment where somebody feels like It may be limited choice, but I still have it. As you're doing this, and as you know that lots of people may want to talk. This is where they want to talk a little bit about some experience. When people talk about a trauma, it doesn't come in an orderly fashion. It comes in bits and pieces. And so we know our job is to listen. And so um, in listening, you want to think about the skills of listening, right? What are those skills that help me listen and listen well? Well, we listen by creating space for silence, right? We're not pressuring people to talk. Sometimes when we hear about debriefing, we assume that the most important thing is for you to talk to get it out. It's almost like this idea that it's a hydraulic method, and if you get it out, you'll be better. Well, actually, getting it out for some people makes them worse. And they need the control and the boundaries to just kind of put it in a box and on a side and to talk about it later. So we never make the listening or asking people about what happened or how they're experiencing it, what they're feeling, what they want to talk about. We may make that a space available, but we never make it mandatory. Obviously, we need to create safe spaces. You might be in a group setting. So I want to be really careful about the kinds of questions that I ask that don't out somebody, where they are feeling that they're going to now be seen as weak or problematic. I'm looking for those safe spaces. You think about children again. Safe spaces may be play spaces, and that there may be some just very what we call sort of side comments that we might make or side acknowledgments about what's happening. And the listening is letting them play and letting them be silent about it. Maybe it's a nod. So this kind of thing, we're preparing to listen, and we recognize in our own anxiety that we can sometimes let our own adrenaline get going. And for even though we have a good intention, we're trying to move people through that time. And you can all know a time where somebody wanted you to talk about something and you weren't ready, right? You've had that experience. So we want to work really well not to do that. When someone starts to talk, you don't want to follow up with 20 questions. 20 questions may be interesting to find the whole story, but that means I started to shape what they were even telling me. But by being silent, it allows them to tell the story, start where they want to start, end where they want to end. I may feel kind of in the dark, but I'm going to work really hard to do the next thing, which is on here, to acknowledge what they're saying, validate it. You've heard the term validation, but validation is acknowledging what you feel, what you're experiencing, what you're saying, really without commentary, without evaluating it. So that brings us to the next
Well,
skill.
I want
Yes.
to I want to touch real quick on this listening because I've heard you say something before. I've heard you ask the question, what's keeping you from listening? Like what's making you want to talk?
Good.
Can you
Oh, you
share a
want
little bit?
you're welcome to
Yeah,
share it
I
as
want you to
well.
share. Well, I want you to share a little bit about that because I think that's so important because we can think we're a really good
Yeah.
listener, but we feel compelled to talk.
Yes, and there are a number of things that make all of us who are even trained at listening not do very well at it. I'll go through a few of those. Number one, our own histories are being triggered. And so now I'm responding to this person out of my own history. Maybe they remind me of my uncle who I don't really like that much. Maybe they remind me of something where I felt really helpless. And so I'm starting to respond out of that. Another one is I really want to be of help. And so when we really want to be of help, we're more inclined to speak. When we're anxious, we speak. I see Jim has posted with first responders, never use the term. I understand that's something that we want to say because we want to connect with the person, but actually the person is probably thinking there's no way you possibly could understand. And even if you could, it may feel like a diminishment of what they've gone through because you see trauma is um, is something that's really we're unable to really explain. Words are not enough. And so when somebody begins to use words and we use I understand, or we try to compare it to something that we've gone through, almost always the person is going to feel like it got minimized because even their own words feel like it's minimizing. And so, better to use your nonverbals, better to use a variety of tools that can let them know that you're still listening, that whatever they said is really important.
Yeah, Jim makes a good point. He says you lose trust immediately when you try to I understand.
Yes.
And I think you said, like, even if you've suffered a very similar crisis in your life, I was with my friend, my best friend, her mom had passed, and I was with her when a pastor came by, and the first things he said was, I understand because my mom died, last year, and I went through this. And it was like a gut punch to me. And I knew it felt like that to her too, because how could anyone understand her unique experience, with her mother?
Mhm.
And suffering is so, I think I remember Diane giving the quote sometime about someone trying to explain suffering. That's another thing we do, is we try to explain suffering, is a clear sign of someone who's never suffered.
Right. Or have forgotten something. So that's my next one that I want to say about what might get in the way of our listening, is that we often want to put their trauma into context. And we do that actually because we think that we're going to um, help them feel better, right? We want them to feel better. And you probably have heard the well, at least. Well, at least you didn't die, well, at least you survived. Um, we want to try to ease their pain by pointing to something positive. And that positive actually feels like it disrespects and devalues the pain that they went through. Lastly, when somebody begins to talk, maybe they are expressing a lot of emotion, and we are rather anxious about those emotions. We feel like, oh, they're crying, they're upset, they're really emotional, and I've disturbed them. Well, maybe what's just true is what they've been feeling is coming to the surface. And what the problem is your discomfort with those emotions. So those are some of the things that might get in the way of our listening well.
That's great. Thank you.
So let's move on to the next skill. We've been talking about it when we're talking about the polyvagal ladder, the common ways that trauma is expressed in our bodies. The more that we can be calming, non-reactive, presence is a really important thing because we're helping them find that stable place in their bodies again, our presence. So, a calming, non judgmental presence. People, when they're traumatized, can say some pretty outlandish things. They can say things that seem a little crazy or a little distorted, and you might want to correct their experience. Oh no, that's not happening. Oh no, you shouldn't feel that way. But in fact, this non-judgmental presence, we can give some basic education. You know what's happening in your body, why your hands are always cold. Well, your body is trying to keep you alive by putting blood to your heart, your brain, your lungs. And it's kind of a strange thing. Let's try something where we shake them out, or we try square breathing, or you try a variety of things if the person is open to it. And can we do it together? And let's see how that goes. So that's that basic education about traumatic stress reactions and are practicing together. See, I notice I asked them, would you like to try this again? And try something here. We have a couple of different things that gives them choice, shows that we're listening. We try a few things. It might not work. We do it together. So it's not just them doing it. I might even have them not do it and let me do it first and say it might seem a little strange, but in that way, we are acknowledging, we're normalizing and reassuring. And we may do that on loop, meaning this is something I have to hear a bunch of times before it makes sense to me. I might even understand your words, but then it's gone because I'm back to being numb or being triggered in some way. And so don't worry that the person isn't getting it. It's just that they need to be reminded. in a basic way. Yes, that's what happens. It happens to all of us. That's pretty normal, actually. Your body's trying to take care of you. And so there's some things we can do to help, you know, bring a little bit of calm.
Yeah.
They might
Wow.
notice that somebody is, and this is happens where somebody seems to not be particularly disturbed and they seem really strong, while somebody else is noticing that and feeling rather weak and unable to help. And that person who's feeling weak thinks there's something wrong with themselves. And so we want to even normalize, like, yeah, people respond really differently. And the person who's strong now later may really need your care and help later on. And even those people who express a whole lot of emotion early after a trauma actually tend to get
Mhm.
healthier faster than those who delay that normal reaction to a trauma. So that's a skill there. Stacy, do you want to add something to this?
Well, I just want to point out, how interesting it is that people can have these very different reactions. Somebody can be very, like you said, very emotional. They're really getting it out. They're expressing it. Another person's very detached, numb. They're not showing a lot of emotion. And both those responses are normal responses. And to be able to say to somebody, to explain a little bit, what you're going through, what you're experiencing. I understand it feels overwhelming, but this is a really normal response to the terrible thing that you've experienced. And for you to say that to someone in a kind, not a patronizing way, but just a kind, understanding way can very quickly bring a sense of calm, relief to the person, um, that they can keep going back to over and over again, that they're okay. This is normal. And like Phil said, here are some things we can do and we can try some things out. I always like watching Phil with crisis, people in crisis, because he'll use language like, well, you want to do an experiment together. Can we try something? Like, can we try some just breathing together for a minute? Or do you want to go for a walk? Or um, let's look around. And one that we do sometimes is it's 5, 4, 3, 2, 1. So look around with somebody. What are 5 colorful things you can see? And then they're looking up, and they're looking for the red stop sign, um, the blue tarp, the 5 things they can see. What are 4 things you can hear? What are 3 things you can touch right now? Can you take your shoes off and feel the grass under your feet? Um, what's something you can smell? 2 things you can smell, and maybe there's something you can taste. Maybe there's some gum or something, or a Coke. And engaging people's 5 senses, but you're coming alongside. And I like what you said, Phil, like you're doing it with them. You're not telling them this thing. You're not doing something to them. You're just offering them something to see if it will help them get grounded and stable. Um, and all of that kind of goes together. It gives them some choice, helps them feel normal, and acknowledges the hard thing. So you're not diminishing the terrible thing they went through. You're not saying it doesn't matter. And you're just reassuring them that there is hope for them to recover from this. And there's some things they can do to feel better. So that
Before
last
you go to the last one, I
Mhm.
thought you've used a movie illustration before to talk about this, and it was a movie called Captain Phillips, I think. I'm not sure the title of it, but that's the character. Would you tell a little bit about why the end of that movie helps to illustrate this point?
Yeah, if you ever watch that movie, there's a part in it where I can't remember the name. Is it Captain Phillips, the name of the movie? Somebody tell us in the chat. But Tom Hanks is playing the lead character, and he's the captain of the ship that was attacked by Somali pirates, and they took over the ship. And in the end, he's rescued. And so the Navy sends the EMT and the paramedic on board, and they are helping him, and he can't he can't make a sentence to talk to them. He's so traumatized. And they're just, it's just such a perfect example, the way this paramedic is talking and keeping him engaged. It's such a perfect example of correct, efficient crisis response to somebody that's traumatized, and how she's able to help him to calm a little bit. And eventually he starts weeping. It's a very moving scene in the movie. But just the way, and actually what I found out later, Phil, is the gal that plays the paramedic in that movie is actually a paramedic. She's not a movie, but like an actress or anything.
Yeah. Nancy Kilpatrick says that there's a book that's helpful to her called A Non-Anxious Presence by Mark Sayers to recognize how my own anxieties shape my interactions with others. Thank you, Nancy, for posting that. That
And
is,
Nancy, thanks for saying that, because it makes me think about self-regulation, right? And how we help regulate one another. And by you being regulated and applying some of these grounding things to yourself, when you're out there working and you're getting distressed and anxious and you're seeing things that are upsetting, apply the grounding tools to yourself. Go for a walk, go get a hot drink, go get a cold drink, move your body. Because just remember, this physiological is acute stress reaction, that physiological shock, and it can happen to anybody, including responders. So apply that to you. You be regulated. So when you encounter someone else, your self-regulation helps them to calm down. Any more thoughts on that, Phil, on self-regulation? We're making good time, so we don't have to rush.
no, I think it's to you for this last one
Yeah.
here on care planning.
Okay. So care planning and linking to resources. That's number 8, folks. People in crisis, they can and they should make their own decisions, and Phil really emphasize that with choice. And he and I are going to fight over like which is the most foundational, safety or choice. I think they both go back to mitigating fear and helplessness. We want to help people feel safe and we want to help people feel empowered. And so if you just keep those things in mind, all these other ones are going to come into focus for you, I think. But people who are in crisis, they may really be struggling, but you know what? They can still make choices. And they can make as many of their own decisions as possible. And that's what we want to encourage. Our role is to simply come alongside and collaborate with them and help create the best care and support plan possible with the resources available. And we always want to do this with the survivor, if possible, and if they want family members or whoever they want as part of their care team. This is a great opportunity for them to use their voice and speak up. And something that happens to people, trauma survivors, if they feel like they've lost their voice, they've lost their ability to choose and make decisions and speak up. And what in crisis, if any of you involved in EMS work and like police work, all that, that often the first responders go on scene and they start barking orders and telling everybody what to do, whatever. And sometimes it's necessary, but what happens is the survivors really get shut down and they get told what to do and they don't really aren't given choice. And if we could just understand how important it is to their recovery to let them start making choices about their own self as soon as possible, to come alongside and walk with them and empower them. And so part of that is we want to be prepared with the local resources that who's doing what in the area. So if you go into an area, I want you guys out there working before you even leave home, do your research, get online and find out who's working in that county. What organizations are working, what groups, what community groups are working, what's going on. Call your contact people, get as much information as you can, get their phone numbers. You never ever want to disengage and leave a survivor that you've been helping and leave them without linking them to further care and support. And, ideally, this is another thing I forgot to say about safety. Identify yourself also. Who are you and what the heck are you doing here? Like, what gives you the right to be here? What are you bringing? I'm Stacy and I work with Crisis Care International, and we are here to do, crisis debriefing or training or whatever. Just be really clear about things like that, but also know who the other organizations and people are. So when you hand off, you can say, hey, okay, this is my colleague Phil, and he's going to be helping you the rest of the day. And these are some resources that we talked about, and I've written them down because remember, people aren't their cognitive processes are slowed down when they're in this amount of stress. You're going to have to repeat things. You're going to have to write things down for them or have somebody that will write them down. And again, and repeat and repeat. So just be ready to do that. Be ready to hand off appropriately with the right resources and link them to care.
A couple of things that we want to say before we get to a really important part of crisis care, which is care for yourself. We want to just talk about the specific problem of suicidality. It's not uncommon that when people go through crisis and their lives are upended, and it feels like they can never get back to where they were, that they begin to become hopeless and even think about ending their own lives. When someone feels like there's no future and that the pain that they're in, emotional or physical, is so high, then it's somewhat normal that we think about not wanting to be in pain anymore. And one of those things might lead to suicidal ideation or thinking about taking one's own life. After disasters, we do see an increase in both attempted and completed suicides. This can be made worse, especially when somebody is overwhelmed with feeling of guilt, and maybe even moral injury. There were things that I should have done or should have known and didn't do, and now people that I love or care about, or even strangers, were hurt and or died, and I can't undo that. And so they can have a moral distress that's part of this. But it's helpful for us to think about this problem. Well, if someone is beginning to feel this way, will we know, right? There may be no information. And in fact, if somebody is really intent on ending their life, they probably don't give a lot of signs. But most people have some, and so we want to be alert to them. They might be talking about just like, I wish I could wake up dead, or I wish I was no longer alive. I just want this to all go away. Maybe they start doing things like giving things away, showing that they don't care, not taking care of their bodies, not doing some things. And this becomes an invitation for you to maybe ask a question or two. A lot of people who are in your situation might feel like at times that they wish they could die. Is that something you ever think about it? Most people do. So here again, you're normalizing, acknowledging something and inviting them to maybe share. And when someone begins to share, if they trust you and they say something like that, well, yeah, sometime, would you be willing to tell me about it? Tell me what you're actually thinking about. And that gives where you might see about intent or a plan or the means. There's a big difference between somebody who says, I wish I wouldn't wake up in the morning, and somebody who is obviously thinking about, yeah, I think about turning the car on in my garage. So there's somebody who has an intent, a plan, and the means, right? There's a difference between somebody who says, sometimes I wish I could just drive, into a bridge, versus somebody who is thinking about jumping off of a bridge. One is harder than the other, actually. So you don't have to be able to know the difference of all of them, but when somebody is starting to show signs or willing to talk about it, ask them the question. Sometimes we're afraid to ask. Like if I ask, maybe they'll start thinking about it. The truth is they've been thinking about it. And if they tell you something, it's because it was already there first. So ask a few questions. How might you do that? What what would what would happen next? So find out, do they have a real plans? Do they have a means? You can ask some questions such as, what do you think the impact would be on others? But what I don't want you to do at that point is to try to talk them out of it. It's not that we don't care. It's not that we don't want to intervene, but trying to talk somebody out of their pain is not an effective response. So, what is effective? You might be interested in knowing that, but there's no one thing that's effective. Getting somebody in mental health, we were taught, get them to contract that they won't harm themselves, actually hasn't been found to be at all effective in research. But what is effective? Frequent touches. That means, and it doesn't mean just you, but having people who are going to check in on them, having a next appointment. Hey, I'd like to see you this afternoon for tea. Can we have tea? I don't know. Maybe. Okay, but I'd really like to be able to check in with you. Okay, I'll come. So frequent touches, check-ins, opportunities for maybe somebody to do something with you that, hey, could you come with me? I really need some help sorting the food that came in on that truck. Can you help me put them into small boxes? So when I start to have something to do that's feels effective, that's helping me feel a little bit empowered, even though I'm thinking about ending my life, I'm less likely. Obviously, if somebody shows a high intent plan and means, then we're going to want to bring other emergency resources, and we may need to get them away from those means and have other more crisis mental health care possible and get other people involved. Stacy, I don't know if you want to add anything to that.
I mean, I think you've covered it. We can only touch on it here. I just want to reiterate what you said, that there is some evidence that in widespread disaster, the suicide rates increase. We certainly saw that in Libya after the flood there and many other places. So just, keep that in mind. If you need to take someone to the emergency room for assessment, you got to do that. And that may be the best next step for them.
We may also want to help, invite them to tell their family or to go with us so that we can talk to another family member who can also be a part of the crisis intervention for them. There may be resistance. No, 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 I don't want to burden them. And so we may need to do some things like that to bring them. But our intent the entire time is to involve them in their own care.
Yeah. And don't forget the first responders in this, because they can be impacted here. And this is very taboo topic to talk about in most areas. And that's in the Appalachians for sure, and also in the first responder community. But it's something we need to talk about. And so, like Phil said, you're not going to put it on somebody's mind. They've already been thinking about it. So if you suspect, it's most important that you speak up and just ask them. Ask them the questions. Are you thinking about this? Do you have a plan? And have you thought out how you're going to do it? And if the answer is yes, then they need some intervention right away. All right, so now we're going to dive into self-care. I want to call this resilient responders. That's what I want to call this. This slide. I'm going to rename it. So.
Yes, well, let's talk a little bit about, and I see a couple questions about suicide, and we'll come back to that in just a minute. I think those are really important questions about children. But, we've been talking to you about some skills that you need. But maybe at this point, we actually want to back up to the very beginning just for a thought and say, people who want to help after disasters and during crises usually have really big hearts. And sometimes their impulsivity jumps ahead of their planning. What do I mean by that? To be a competent helper in crises, you need not to go alone. You need to have a plan. There are stories and reports of people who are driving up into the mountains to help. And I am sure they have good hearts and high intents, but sometimes they end up being part of the problem in the long run. So if we're going to be competent crisis care responders, the first thing we need to know is, who am I going with? And also, who am I connecting to once I get there? And this is part of our self-care plan. You must know that when you insert yourself into a disaster, disaster has a way of working itself into you. You cannot go there and be a Teflon pan, impervious to all the things that you see, smell. It will change you. It will change your outlook on life. It will change your hope. It may affect your own faith commitments and your own understanding of how the world works, because you're going to see things that are really broken. So you want to watch for the signs of secondary trauma for you. So those things we're talking about, trauma responses, do you see them in you? Do you start to have nightmares, intrusive thoughts? Are you starting to numb? Maybe you're drinking more, or you are doing other things not to think. Maybe you're avoiding certain kinds of things, right? Um, um, and so do you see them in yourselves? And are you talking to your coworker about them, so that you're not just keeping it inside, but actually practicing good listening to each other, good caring for each other, good giving each other empowerment and choice without feeling the shame like something's wrong with me because I'm being impacted. Um, Working amongst broken things means you're going to start to feel it yourself. So, do you have good practice for grounding and regulation? I have seen often that first responders and crisis responders don't do the very things that they are teaching others. They don't take time to rest and sleep because, well, I still have all these things back home, so I should just continue. I'll sleep when I'm dead, kind of mentality, which unfortunately means that you're probably going to burn out or have secondary trauma sooner. So, what is your support system? How are you debriefing with yourselves? It doesn't mean you have to tell everything you saw, but it might be talking to one person about one thing that's stuck in your head that you can't get out and you're struggling with. And you might even tell it rather briefly and then figure out what you might want to do with it.
I want to say here, Phil, when it comes to the debriefing in your support systems, this is something to be very intentional about. And some people prefer to debrief with the very people that they, have deployed with, or people who've been on a similar deployment, who are in their same profession or whatever. And because they feel like those people understand, they get me. Other people, they don't want to debrief with anybody in their same field or work. They want some completely neutral person outside. So it kind of just depends. And a lot of us, we don't want to go home and just spill everything out to our family and close friends. So, but we need a place where we can bring the things that are bothering us, the things that we can't forget, things that we are carrying around. So who do we talk to? And I just want to ask you, like, what are some things people can do to create that kind of community of care, for themselves?
So as you continue to see things on this slide, you're thinking about just some of the most basic things, the food you're eating, the exercise, drinking of water, getting rest. Even our military in the midst of battle will rotate people off of the front line for rest. Maybe it's not enough, but if the military knows this, in order to keep a good fighting force, then you would expect that our civilian forces need the exact same thing. So are we doing things that can be restorative? Maybe that's something in the evenings where you're, having a little bit more creation around you. That might be using art or music or dance, movement, something that will be able to be restorative, that you can maintain a practice. Maybe that's doing yoga poses and or writing poetry, or reading, something that seems like a silly novel, but something that allows you to be able to let your own body come back to its natural state of safety and rest. Um, Not only do people who've survived a crisis and a disaster and are in it need a care plan, but we ourselves need one. So if you are involved in being a crisis care responder, I would highly recommend that you develop your own plan and share it, and then ask that person to hold you accountable. Are you doing those things?
Yeah, and we encourage organizations that don't already have some kind of peer support in place. We really encourage that. And this whole idea of a community of care where you kind of normalize the whole idea that people who work in trauma, they're going to need some debriefing. And so if somebody comes back from a deployment or something and they're like, that was really hard for me and I just want to talk to somebody. We don't, there's no stigma attached to that. It's completely normal. Of course, they need to talk to somebody. So let's set it up. Let's do it. And maybe even as peers, we're trained in peer crisis debriefing so that we know how to help somebody. I can just ask my friend, how are you doing? I know you went on that last deployment, was tough. You want to go for a walk? We can talk about it if you want to. It can be as simple as that little invitation. You're not making them, but you're offering. And then give them a safe place to talk about the things that they saw and heard, the things that stick with them that they can't seem to forget, the things they don't want to forget. What were some of the good things that they experienced? Just kind of that natural and acceptable. And it doesn't, again, like it doesn't, there's no stigma attached to having that kind of peer support.
Very good. Maybe now you would like to have some questions that maybe have been brewing inside you while we've been talking in our last just under 10 minutes. We want to give a little bit of room for that. I did see a question about rates of suicide in children. I don't have that in front of me. We are in general seeing um, uh, uh, child suicide rates across the board in the United States increasing. But I don't have the numbers on what those are. But anytime you have a chronic sense of hopelessness and a sense of no future and emotional pain, we do see spikes in suicide rates. And one thing to think about, a preventive feature that's both for trauma and suicide, is that when I have people around me who see my pain, who are willing to listen to it, who are supportive of me, who can maintain some level of community care, suicide rates drop. Just as an aside, just thinking about First Nations in Canada, was looking at some research there on the problem of suicide. And in those communities where there were storytelling, some basic education, and community care, the suicide rates went to nearly zero. And that's because I'm part of a community. My identity um, is connected to something positive. And where the communities were really disconnected and isolated and had stopped providing some of that, the suicide rates went up pretty dramatically.
And I guess I want to say then here, this is just something for us to keep aware of because the Appalachian communities are very tight knit, and this has destroyed some of these communities. And this, this will separate communities and
Mhm.
families, and they will not have that kind of support that they need that Phil's talking about. And so, keep that in mind. It's going to be really devastating for them.
Stacy, Stephanie is asking about tips for teachers who will be working with children who
Yeah,
have been impacted.
yeah.
And another person asked a similar question: how do children's needs in crisis compare to those of adults? Is there anything unique to their experience? I'll start with one on that, but I'll ask you to think about those tips. Um, Children, by definition, are quite aware of what's happening, but they don't always know why or what it means, depending on their age. And so we might think that children are understanding what something means, but the vocabulary and things that are used often need more explanation. So simple, direct explanations are best when we can. Children should not be lied to, should not be deceived, because that's going to break trust. And when they do discover it, it's going to cause problems later on.
Mhm.
Um, because children don't necessarily have the same vocabularies, we may see it coming out in different ways in their behaviors. We may see some regression at times. We may even see some parentification, like where they end up taking on more responsibility because they feel responsible for that. And so having adults who can name what's happening, but also point them to maybe something that helps uh, them feel safe and stable and connected, and gives them something they can do, maybe helps reconnect to some play and some other family activities. If it's a family that has spiritual activities, maybe praying together, reading something together would be something that helps them stay grounded. How about for teachers? What can teachers do, Stacy? What are some
Yeah.
tips?
Well, we're about to tonight we're putting out a little video on Instagram for teachers. So it'll be fun with 3 or 4 little tips for them. But we just want to encourage teachers because they're doing a great job right now and trying to get the kids back in a routine. That's so good for them. They really need that. And just encouraging teachers to remember that, what we said about perception, trauma is about perception, and your perception when you're a kid about what's terrifying and how helpless you are is different than as an adult. And so kids who you just can't compare kids to the adult experience. They may be really traumatized about something that the adults thought was not a big deal, um, or wasn't as hard. So just being willing to listen, to pay attention to their experience, to notice. With kids, you really got to notice it's behaviors that change because kids are kind of acting out. They don't have words, like Phil said. They don't always have words to express what's going on inside. And just be patient, be patient, be patient with these kids and get them in a routine. There's some really great material out there. The Trauma Healing Institute has some terrific material for kids. I think some other folks, if you guys know of any, you can put those up in the chat right now.
Stacy, Alexandra is asking a question such as
Mhm,
how else could she deepen her crisis care skills and
mhm.
her competency? Are you thinking about any other specific trainings that could be had?
Well, I mean, you can always, there's lots of good stuff. I think the WHO has some great little trainings out there. You can get PFA training. I mean, we've covered all the PFA essentials in this course, but I'm all for people going out and getting other trainings. Um, we've tried to give you some real foundational stuff. We do offer more than this. So we have other workshops. We actually do a 1 or 2 day, like a full training in essential crisis care, and it covers a lot more topics. We've got a book on Amazon that we created sort of contextualized for a faith community, but we have an adaptation that's coming out soon that's completely not faith related. So either one of those, the material in it's all basically the same on crisis care. And we cover other topics, like we do cover helping kids in crisis, trauma and grief, that kind of thing. In a few weeks, we are going to be having another training, and this one will be about 4.5, 5 hours on crisis debriefing. And so if you'd like to learn that, I encourage you to do that. Some people like to go get trained in SISM. You can do that if you want to, but there's not a magic training for crisis debriefing, but there are some really important things you should know if you're going to do it. So if you sign up for our newsletter or for any of our alerts, then you'll get the details about that training coming up, when it is, how long, all that. We do have a workshop on helping kids in crisis. It's like an online or in person. We do that for educators, for people who work with kids.
Stacy, what's the name of our book?
Oh yeah, the name of our book. Hold on.
You can
There
find
it
it.
is.
There it is. Essential Crisis Care Training Guide. This is designed more to train local leaders on how to be more aware of what is crisis care, including understanding the grief and the grief journey and how that affects people. There is also some special topics that show up in this as well, dealing with sexual assault, which sometimes also shows up in certain kinds of disasters, and suicide and caring for children. So there's a variety of things there. There was a question as well about group work, and I just want to say that sometimes we think, hey, we could help more people if we put everybody together and get them to talk about what they've gone through. Some people, a group would be dysregulating, and that's because somebody might be sharing a part of a story that either feels like it invalidates their story or is overwhelming. And so I'm not against group work, but it really does require um, a lot of more skill to manage a group like that and to make sure that people are learning together. Clearly, if a good group is happening, then people feel connected, they feel seen, they feel heard. That's good. But just be sure that you understand good group process and what the limits of that are so that people understand what they're doing and what is helpful and not helpful.
Yeah. This has been so great. We appreciate all of you. Thank you so much. For those of you who donated, this was a free training, and we don't want there to be any pressure for anything. We just want to say thank you. If you like what we do and you want to see us grow, because we want to grow, please think about a recurring donation in any amount to us would be such a great thing and help us just to do what we do and to expand our team. So we want to get this information out as far as we can, and we are happy to do another training. We're happy to do trainings online. We're even willing to come to your community and work with you, and just reach out to us. I think I gave you that information right there. Thanks, everybody. I hope it was good. Give us feedback. Give us all the feedback. I'll be sending out a survey. Please be honest. It helps us to do better. We want to know. Thank you guys. God bless.